So today we're going to talk about recognizing signs of medical distress for healthcare workers and caregivers. Some of the objectives: identify early warning signs of common medical emergencies, understand the FAST acronym for stroke, recognize symptoms of hypoglycemia and sepsis. We're going to review local statistics and relevance. And we're going to do a little bit of test your knowledge with some real life examples. So, did you know Louisiana ranks 5th in stroke related deaths in the United States? Now, this is according to an article published by the CDC in 2023. Heart disease is the number one cause of death in Acadiana. Diabetes prevalence in Louisiana is 13.6%. The national average is about 10.5%. Acadiana's elderly population is growing, so more of them are at risk for sepsis and stroke. Now, this is according to the CDC and also some statistics that are specifically for the Acadiana region. So here's a list of some of the most common conditions. We're not going to talk about all of them, but we are going to talk about some of them and not getting too much in depth with them. We're just going to save that for another training because these conditions entail so much more details. So some of them are stroke, heart attack, hypoglycemia, hyperglycemia, seizures, sepsis, respiratory distress or respiratory failure, electrolyte imbalances, medication reactions or overdose, syncope, which is fainting, and mental status changes. So the first one, recognizing stroke, and we use the FAST acronym. F is for the face drooping. One side of the face is drooping. You have that muscle weakness. You have arm weakness. A is for arm weakness. S is for speech difficulty, because they tend to have a little difficulty speaking. And then T, which is time to call 911. So additional signs would be like sudden confusion, trouble seeing, balance issues. So you want to make sure you act fast because every minute without treatment matters. So we do want to act very fast if we suspect any of this. Heart attack, the warning signs that you want to pay attention for heart attacks. So the classic signs would be chest pain, tightness, chest pressure, might have pain in your shoulder, back, neck, or jaw, shortness of breath, nausea, sweating, or lightheadedness. In elderly women, they may present as fatigue, indigestion, or dizziness. And a fact about Acadiana, cardiovascular disease caused 1 in 4 deaths just in the Lafayette Parish, according to an article from 2022. Heart attack symptoms can differ based on gender and age. So when in doubt, just report it. It's better to overreact than miss a warning sign. So what do you do if you suspect a heart attack? You're going to call for emergency. Dial 911. If you're in a facility, of course, the facility has internal codes, but you want to stay with the patient. Please don't leave your patient. Stay with the patient. Keep them calm, seated or lying in a comfortable position. Do not allow them to walk. You want to report those symptoms clearly to the nurse or to the physician. And if you are trained appropriately, you're going to prepare oxygen or administer aspirin if ordered. This is only if you're trained to do that and you must have an order. Please don't try to do this on your own. Next one is hypoglycemia, which is low blood sugar. So with this, signs of distress would be sweating, shaking, hunger, irritability. You'd be confused. You might notice the patient dizziness, or they may express that they're dizzy. Blurry vision. This can lead to seizure or a coma if it's not treated. Hyperglycemia, which is high blood sugar, increased thirst and urination, headache, blurred vision, fruity smelling breath, which is called ketoacidosis. There'll be fatigue. Always take behavior changes seriously. They could signal blood sugar imbalances. So you want to make sure you know your residents' diabetic status and look for those trends. When in doubt, check the finger, do the finger stick, or alert a nurse or a healthcare provider immediately. If you are trained, check the resident's blood sugar. It is a simple, finger stick, but I think that there are some facilities that have sitters that they're not allowed to do that because they weren't properly trained, and I'm guessing it's just for legal reasons, because it is just a finger stick, but still for legal reasons, just make sure that you're able to do that. For hypoglycemia, if they're conscious, you want to offer them a quick sugar acting, like a fast acting sugar drink, like juice or like a glucose tablet as directed. If their sugar is high, you want to encourage them to intake some fluids. Do not give them insulin unless you're ordered to give them insulin. So monitor them closely if things start to get worse, because they can become confused, unconscious, or possibly start vomiting. And do document, everything. The next condition that can bring about signs of distress would be sepsis. This one is a silent killer. With sepsis, think time, and that stands for temperature, infection, mental decline, and extremely ill. So the temperature could be high or low. Infection signs are suspected. Mental decline, they can be confused, sleepy, and they can become extremely ill, like have severe pain or discomfort. Just in Acadiana, sepsis is a top reason for hospital readmissions in older adults in Louisiana. Sepsis progresses fast. Early signs can be subtle but deadly. So especially to watch the elderly or the immunocompromised patients. So look for changes in those mental status. It's often the first clue. Acting early can prevent them, from being in ICU or even death. So what do? Immediately notify the provider or supervisor. It is a true emergency. You want to report any symptoms clearly, like fever, chills, pain, mental status changes. Check their vitals if you know how to do that, especially like their temperature, heart rate. Don't delay anything because early intervention can save lives. And you want to make sure you monitor them closely and document those changes in the condition while the help is on the way. Electrolyte imbalances. This is one that's not talked about enough when we think about monitoring for signs of medical distress. Most times, this is something that can be ignored, especially when it comes to the potassium, if you don't have a regular provider or regular doctor. So the key electrolytes are sodium, potassium, calcium, and magnesium. The common imbalance symptoms would be muscle cramps. Everybody has dealt with that or have known someone that has dealt with that. You'll get weakness, irregular heartbeat or palpitations, confusion, lethargy or seizures, nausea, vomiting. The electrolyte shifts can happen quickly, especially with vomiting, diarrhea, or diuretics. Mental changes and muscle problems are often the first signs. So always notify the nurse about unusual tiredness, like twitching or like chest discomfort. What do? You're going to observe and document the symptoms. Notify the nurse, the supervisor, or the healthcare provider about those observations. Check the vital signs if you're trained and know how to. make sure you pay attention to like their heart rate, blood pressure, and respiration. So a few examples would be like if someone is experiencing like a headache, confusion, or even a seizure, that could be a sign of hyponatremia, which is low sodium. And then if they're having like cardiac arrhythmias or muscle weakness, it could be a sign of hyperkalemia, which is high potassium. So we do want to make sure we pay attention to those signs. So let's test our knowledge. What does the S in FAST stand for? I'm going to give you a little time. We're going to go through all 4 of them and then we're going to check our answers. And then number 2, a resident becomes sweaty, shaky, and confused. What's your next response? Like what's your action? What do you do? And then number 3, what are 2 subtle signs of a heart attack in women? And number 4, what infection-related signs may point to sepsis? So the first answer should have been speech difficulty. Number 2 should have been check blood glucose, offer juice, or and alert a nurse. Number 3 should have been fatigue and indigestion. Number 4, fever, mental confusion, and severe pain. So this is a slide that I included in here for local impact and empowerment. Quick response can reduce brain, hearts, and organ damage. You are the eyes and the ears at the bedside, at the home. You know the patient well. You spend enough time with the patient. Report those early signs. Act fast and save a life. Always stay alert, stay trained, and stay compassionate, because you never know what the patient can even share with you, being that they may spend so much time with you, they may be a little bit more comfortable. So some of them feel inclined to tell you stuff that they wouldn't tell their provider or their family member or someone other than you. Your role matters. Sitters, CNAs, UAPs, and nurses are frontline defenders of patient safety. You're often the first to see, hear, or feel that something isn't right. Quick reporting can mean the difference between life and death. So how can you make a difference? Well, with your observations, as we've been talking about. With your observations and instincts can trigger life-saving interventions. So make sure you do stay alert and make sure you're watching for those signs and you document everything. You don't want someone else to come behind you. Let's say you're changing shifts. You don't want someone to come behind you and they find something that you didn't. So you want to make sure that you are staying alert, you're watching everything, and you're documenting every chance you get. You never know when you can be the one that can actually save a life. Some sources and further reading would be check the CDC's website. They have some great information for stroke, heart disease, and diabetes data. You can check the LDH, the Louisiana Department of Health, for any regional stats. Also, Sepsis Alliance, however you want to pronounce it. They have some really good resources on there. And then, of course, the American Heart Association. That is always my go-to, the CDC and the American Heart Association. They have some of the most interesting articles that you can read about. They also have some practice questions and practice exams on there, just if you want to stay up to date, with things. I would say take your time and read some articles from this. You never know what you can learn. I always try to make sure that I know as much as I can so that if the patient asks me something, or I can be the first eyes, for the patient, or the first ear or something for that patient. So they have some really good resources on here. So I do hope that you take advantage of that. And until our next training, have a good day.